This is the Psychedelic Medicine Podcast.
Hello and welcome to the next episode of the Psychedelic Medicine Podcast. I'm Dr. Lynn Marie Morsky, your guide on this journey, and today we'll be discussing ketamine for PTSD with Dr. Stephen Radowitz. Dr. Radowitz is the Chief Medical Officer and co-founder of Nushama Psychedelic Wellness Center, which utilizes ketamine-assisted therapy for the treatment of various psychiatric mood disorders. Now, before we get to Dr. Radowitz, just a reminder that the Psychedelic Medicine Podcast is for educational and informational purposes only. Nothing here is to be construed as medical or legal advice. And one more reminder, if you are a clinician and you would like to learn more about psychedelic medicines, please check out the Psychedelic Medicine Association. It is our mission to educate you on psychedelic medicines and their indications and which ones are currently legal and how they can be accessed so that you can have confidence in discussing these with your patients and referring them when appropriate. You can check out our association at psychedelicmedicineassociation.org. Now, without further ado, thanks so much for joining us today, Stephen.
Thank you for having me.
I'm looking forward to this discussion, and you have a very interesting background that I think will be applicable in a number of ways to our current discussion. So if you could just tell us just a little bit about the kinds of work you were doing, and you can even mention the Goldman Sachs, because I do think it will actually play in, but the kinds of things that you were doing before. Yeah, exactly. Before you got into treating mood disorders with ketamine.
Right. Before years when I first moved to New York, I worked in an underserved hospital, St. Clair's Hospital in Manhattan, which was an underserved hospital treating had a very large HIV population of HIV patients. Really it started before the protease inhibitors came on. So it was a very, I guess, a traumatized group, you can say the least. It really drew from not only the gay community but also the prison community. We had a prison ward in the hospital. We also ran a heroin and alcohol detox unit. So we're dealing with a lot of HIV through IV drug use. So I spent a number of years there, and so you can imagine, definitely a lot of trauma, a lot of issues. And we didn't have the resources we have maybe today and the treatment modalities that we have today. Of course, it's that landscape has changed significantly since then, which is thankfully. And then, of course, I moved on from that and I went into private practice, and I still treated people with opiate use. I was a provider. I used Suboxone to help people with opiate use disorder, which was incredibly effective. And I treated HIV from the outpatient perspective. And then, I also was primary care. I ran the primary care program at Goldman Sachs. The group private practice I worked for, was part of that, part of the program there. And so I ran the primary care program there, and it was wonderful, and has its own, ups and downs and traumas like anything else on a different level. So.
Yeah, I imagine. Were you there during 2008?
I was at Merrill Lynch at the time, but yeah, I was transitioning there. Yes, I was there when they closed. They closed our center at Merrill Lynch due to that event. So I actually saw some of the people who were involved in that. It was quite traumatic. That was my trauma.
Oh, that was your. Yeah. I was going to say, yeah, it's a very diverse background, but with very different and not giving them any kind of hierarchy. Those are all types of trauma. A lot of people lost their jobs at that point, and I'm sure there's significant traumas in all of those. So, that leads me into how did you start working with ketamine? And one of the things that we notice with a lot of these different psychedelics, and we're keeping ketamine in that category for now, is that they seem to have this ability to treat so many different diagnoses. And while MDMA gets a lot of the press on being helpful for PTSD, and we know it has its specific mechanisms, I was informed that at your center you're having a lot of success with ketamine for PTSD. So if you could tell me what led you to start experimenting with ketamine in that population, and I guess some of kind of the kinds of things you've been seeing.
Yeah, I think interestingly enough, as much as we we segregate all these mood disorders into separate disease entities, there's really no proof that there's actually a common seed for them all. They're just a different manifestation. But I say about 95% of the people who come in here have some type of trauma, developmental, a difficult life event that was really never properly processed. And so that gets over time and gets reimprinted and gets sort of entrenched, and eventually manifests as severe anxiety related to the trauma and what we call PTSD. So, and there's different levels of PTSD and different degrees, of course. So it's not a sort of a separate entity with a gene that's, specifically for anxiety, for PTSD. It's like there's really it's all the same. I think there's a common seed. So that's why a lot of the treatments we use right now for depression or for anxiety, for PTSD, it's the same treatment, SSRIs that we've been traditionally used, and same thing for psychedelics. So I think the beauty of it, what I saw is that, number one, when I started doing this, in the medical intake, so I'd ask people about any traumatic experiences, their childhood and all that. And everyone had some type of difficult trauma, obviously processed in different ways. So, and so we send people these, we have PCR, we have all these sort of standardized questionnaires where we send to people for anxiety, for depression, for PTSD. And so we saw some people were more entrenched. So actually, we had a few people with very severe trauma that were doing well with their anxiety scores and their depression scores, but their trauma scores, their PCL scores, were sort of lingering. They weren't really going into letting go of the trauma as we would expect. And so although they felt the mood was better, but they still were sort of, still entrenched in that. So we've been working with some interns from Columbia University School of Social Work. They're amazing. And one of our interns from last year, Henry, he brought up the idea, we came up with this idea of using sort of an exposure, this self-directed narrative exposure therapy, which is well studied and accepted, and I can send you some information on that. And then we started instituting that in addition. So they would have three ketamine treatments, and we saw that they were not progressing in their trauma score. So we started instituting this self-directed trauma therapy, and it was really just sort of written therapy. It was really self-directed. It was much simpler and easier to use and less traumatic to use than some of the other traditional exposure therapies. And we had a few cases of people just completely breaking through. Where they'd really been stuck before, their PCL scores to really start to come down, and as did their depression and anxiety scores as well, along with that. And so we're in the process of actually designing a study. We're waiting for some IRB approval, which I think we just got, to do this study moving forward. And it's it's interesting work, and I love the fact that it's self-directed. So
yeah, I was going to ask a little bit more about that. Is when in the ketamine session do they do this self-directed trauma therapy?
Right. Yeah, so it starts off actually as a virtual visit before. So it's a few days before they do it. They work on it. They come up with the narrative, and then at the beginning of their session, before we start the ketamine, they'll work with the same therapist, and they'll read through the narrative, and then we start the treatment. And what we were doing, we had two ways of doing it. Whether they would just do the therapy, they would read the narrative and then go into the full psychedelic experience. And then there was another model where we use a lower dose, more psycholytic dose, where we sort of open them up. They do under a more sort of a heart opening situation, and then they read the narrative in that state, and then for about 15 minutes, and then the remainder of the 45 minutes of their journey, they go into a full psychedelic eye mask, earphone, in a really inward experience, psychedelic experience afterwards. And that's we did both, and both amazing. So
very interesting. What are some of the types?
Yeah.
What are some of the types of things that patients are reporting after this? Are they telling you anything about how they now view what had previously been such a traumatic event for them?
Right. It allows them to almost reframe it. So things might trigger them to some extent, but there's almost like a buffer. I describe it as almost like a double pane window. You see a double pane window, when it's two sheets of glass with some with just a little space in between. So when there's a temperature change on the other side of the window at night, you have a little bit of time to turn up the heat. You have time to respond to it rather than reacting. If the windows were wide open, the temperature changes, you're scrounging around, turning up the heat, trying to find a sweater. You have time. So these traumatic events, although it doesn't take away the memory, but it decouples the memory from the emotion. So when you're triggered, you don't go right into this sort of sympathetic drive, this sort of, these deep emotions. You have a little bit of time. You have a time to reframe the situation, and choose how you want to see it and how you want to respond to it. And that's the most important. That's what it does. I see.
Yeah, we had the Psychedelic Medicine Association. We had somebody on telling us about some of like the actual brain workings of like retrieving memories, and he was telling us that when you retrieve a memory, every time you retrieve it, it like gets re-imprinted, but with kind of the surroundings of the retrieval. And so is that
Right.
what you think is part of, if they're retrieving it in this much more, like you said, heart open space, that
Right.
leads to a different imprinting?
Right, a different imprinting and a different emotion associated with it. So instead of those deep emotions, they had the fear, the anxiety, the reliving. It's actually coupled to a more open state, an ability to see it more, and then a more open, happy state. So yes, that's I think how it works. And yeah, I mean we don't know for
And what
sure, of course, but
Right,
yeah,
right. All of this is
yeah.
still kind of a mystery. But I was wondering how long. And in that same talk, he was talking about the actual, ketamine leads to these kind of like spine, I think dendritic spines maybe that appear,
Dendritic
and then
signs, yeah,
yes, as part of the
and regress.
neuroplasticity.
Right, so we call it it's a neuroplastic process. Yeah, sorry.
Yeah, and he was saying that those spines eventually go away, and that's kind of what correlates with ketamine's durability. What have you seen in your patients with PTSD? Like, we've done different episodes on like how durable ketamine is for depression, and we know that they have to come back for boosters, and that it's more efficacious than a lot of antidepressants they have been taking. But
Right.
what are you seeing for the durability for PTSD?
Yeah, I mean, I've seen it. I think it's longer. It depends on the dose. So in our clinic, we tend to bring people to more psychedelic dosing. So we escalate. We start off, our protocol is a series of 6 infusions over a 3-week period. With PTSD, we might escalate a little more. So we start off at 0.8 milligrams per kilogram, which is a little higher than some other centers. We found the zero point 0.5 just not effective. And I'll tell you about an interesting study that sort of speaks to that. And then each time they come in, we always have a discussion with our members. We call them members, to decide, number one, to get permission to give them the dose, and then to discuss the dose itself. And then so each subsequent visit that they come in, we say, okay, we discuss how their previous experience was, how are they feeling since the last experience, how are their scores maybe changing, and then we come up with a dose. We tend to go up by 0.2 milligrams per kilogram each subsequent visit, up until a point where they say, hey, that was enough. That was good. I'm okay there. And the dose doesn't always correlate with the experience. It usually doesn't. I can give people the same dose with the same music, same everything, and they'll have completely different experiences each time. That's people have to understand. So there's some element, I think, as we escalate the dose. Obviously, I see it almost like as a dimmer switch to this sort of default mode network, this sort of the ego, and it gradually decreases it more and more. So you're processing less through this intellect and more through our heart. I know it sounds a little woo-y, but through our sort of an intuitive, an energy, or whatever you want to call it, a soul, a deeper part of who we are.
Yeah, absolutely. That
Yeah.
makes sense. And so you were saying that the durability seems to kind of correlate with their
Right.
dosing. So are you saying the ones that get a higher dose seem to have a longer
Yeah.
effect?
I find
And
that,
what does that
yes,
look
I
like?
find that the ones that are open to work, so it's also not only a matter of the dosing, but also how much work they're willing to put into it afterwards. We talk about aftercare, and all of our members who come in, we talk about reading certain books, maybe spiritual books on Buddhism that opens up their idea to seeing the world in a new way. Breath work, meditation, yoga, exercise, community work, volunteering, whatever it may be. So to do some things that change the way they've been living their life, so it's important. They have to put some work into it. So the more they're open to doing some things and to living and living their life in a little bit of a different way, I think the effects, the longevity of the effects, definitely are related to that. definitely, and how deep they're willing to go into the experiences. So, those are willing to go into higher, more dissociative states. I found that those people who tolerate it and are open tend to do better and have longer effects. And some don't come back ever for boosters, And I followed up with people over a year and they're doing great. I mean, they have major breakthroughs and I can talk about a number of those. So,
Oh,
yeah.
yes. I was going to say, like, let's talk about the adjunct things, but let's
I'll t-
let's throw in a major breakthrough. I've got my notes down. I'll remember to ask you about the adjuncts, but I'd love to hear one of the stories, one of your
I
favorite
mean,
experiences.
one of my favorite ones and most difficult for us, that it really taught me a lot, was that there was a person who was deeply suicidal for years. The only thing that really kept him alive is that he had full custody of his child. His wife had a lot of issues and was lost full custody, so he had full custody. And his fear was if he killed himself, his daughter would have to go back to his ex-wife, and this haunted him. And in the journey, he actually killed himself in his journey. It was a high, very dissociative journey. And he was watching. He was at his funeral, watching his daughter going back with his wife, going back to his wife, and he was screaming. I mean, it was really, I've never seen. It was one of the most intense cases we ever dealt with. But he was screaming, hitting himself. How could you do this? And he was almost like violent. We went in there, and the nice thing about the IV ketamine is we can dial it down. We calmed him down. We, did some breath work, but I didn't take him out of it. I kept him in it, and it was very important because I knew this. I didn't know exactly what was going on, but I just knew it was something important. And if you could really hold space, this is where the staff comes in. And you have to really have experience. We brought him down, and then afterwards he told us what transpired in the journey. But he was yelling, "How could you do that?" And hitting himself, really hitting himself. And after that, completely changed his life. Completely changed his life. The suicide went away. He developed a deep appreciation for the number one. He's alive. He's with his child, and he lost that appreciation, and so that was very intense and very, very effective. So someone might, and a lot of people might deem that this is a bad trip. This is a terrible trip. But afterwards in integration, we really worked on it, processed it, and it was the most transformative trip for him. Another woman with deep sexual trauma, came from a very religious household, deeply religious household. The first two times also very difficult. She couldn't sit down. What are you doing to me? And it was very weird for her to be in this situation. It was very out of her comfort zone. And after the second, something clicked. After the third one, everything changed. And she was a painter. She would paint these very hyper-realistic paintings, religious paintings and whatnot. And after the third one, she sent me this email with these new paintings she was painting. And she goes, "I don't know what happened to me, but my painting changed, and I'm painting for my soul. I'm now painting for my soul. I'm no longer painting for my ego." And there are these beautiful paintings. I have one right next to me, but I don't want. Maybe I don't want to. It could identify her, so I won't do it. But it was just phenomenal, and she really she did really well for. I was talked to her, and she finished it well over a year ago, and she's still doing well. Transformed, still has ups and downs and things like that. The trauma's still there, but she's processing it. She could work through it and live through it, and she's no longer seeing her life in sort of in relation to that past trauma. She knows that what's going on now is different than what she had now. Certain things will trigger her, but she could bring herself. There's more of a buffer there, more of an opportunity to reframe that situation rather than going right into where she was. So.
That's really interesting.
Yeah.
And you brought up something that I hadn't kind of thought before, but when she referred to that she was painting from her ego, as I'm imagining that survivors of super traumatic events, like you were describing, maybe some part of their ego is, especially if it happened during like ego formation periods, and not that I know exactly when that is, but some transformative period of childhood, that becomes part of the person's identity, is like, I am a person who had this terrible thing done to them. And I imagine that if you go to, the psychedelic phase and you do have ego dissolution, that perhaps that's part of how they get to heal from PTSD.
Yeah, I think that's exactly. I mean, it humbles you. I mean, a true psychedelic experience is incredibly humbling. I mean, it takes you to a place of deep presence, but also very, so like you remove yourself from your current situation. And I say, like, I always tell people the medicine isn't the ketamine or the ayahuasca or the psilocybin. It's really yourself. It's your essence. All those substances do are there's different chemical keys to sort of reduce the influence of the ego, of your intellect. And all that intellect is built on our past experiences. So we see the world, we sort of predict, it's there to make sure that we survive in this world. And it does so by predicting future dangers based on those past events. But those past events are no longer valid today. It's like an operating system we haven't updated. So it allows us to reboot. So in these journeys, you get to step outside of that and see the world and feel this deep presence. So no matter what you're experiencing, and with ketamine and with psychedelic dosing of ketamine, you see some unbelievably multidimensional things I can't even explain. But and you'll see it come, and then the music will change and everything will dissolve and you'll dissolve with it. But no matter what you're seeing, there's a beautiful presence, a beautiful conscious presence that's sort of always there. That's you, that's watching this come and go. And people said, oh, I thought I died, but well, who's I watching the death? Like, who died? What died? I'm still here. I'm still very present. And you're more awake. People don't realize when you're in those states, you're more alert than you are in your conscious state right now, much more. And although you're witnessing these things, so you're this witness, and it's almost like liquid meditation. And that presence, that consciousness that you have access to through the contrasts of these psychedelic experiences gives you an appreciation for it. And that's always there, and it's always been there. It's here now and always will be. So people have the medicine within them. We lose sight. And these traumatic events and all that, eventually they cover it up. It's like shells around it. So we just remove the shells. You get a taste of who you are at your essence. And then when the shells and the ego comes back on, hopefully there's a better calibration. So you're more aware. And there's always going to be a challenge. Listen, that's life. I mean, we're all going to be challenged. We all have our challenges and our traumas and on different degrees, big T, little t, but we have our issues. And it's all there to work through and to hopefully, go through that process.
Yeah. Yeah, absolutely. What are some of the adjunct things that have helped patients? Because one of the things that I know in the recent research that came out showing that the critical learning period that ketamine opens up is about 48 hours. And I remember like back when I had, visited a ketamine clinic and done mine, I just knew that like for some period afterward, you should, just listen to nice music and don't do anything stressful. But I had not seen the research that it's like, you got 48 hours, right? Like what are people doing in those crucial time periods, those adjunct things and those time periods, and like you said, even following that you found really helps with the durability of their treatment?
Yeah, so we do recommend, I've seen probably about 8,000 of these here since I've been here, quite a number. And I'll tell people there is, and it's quite accurate. I find that 36 to 72 hours after is this sort of peak time, this sort of soft spot. So, but often the night of the treatment, sometimes people have a hard time sleeping. They don't feel great. The next morning, they're feeling a little groggy, feel off. I always tell people, wait until the next night after the treatment. And then the day after that is really when people start to really open up. And that's where I think that peak neuroplastic process happens. That's what I've seen. And so I don't know how many really good studies there are on that, if there are any. But from my experience of seeing a number, I could tell you that that's actually not so inaccurate. And what I do ask people do in that meantime is really, number one, avoid alcohol, avoid marijuana or any type of let the brain do its thing. Don't interfere with anything. Like, stay away from social media. I'm a big, I really tell people that's a bad drug, and it is a drug, and I mean, believe me, I indulge in it also sometimes. It's an escape, but I don't think it's good for most of us. Stay away from negative things on TV. Try and I tell people, when you get home, take a nice bath, take it easy. Don't engage in anything too strenuous. You can go out for a nice drink, but stay away from, and I encourage people to start reading books. Breath work. I'm a big fan of breath work. I think breath work is so stupid, simple, and so incredibly powerful. I love this 4-7-8 breath. I use it myself. I don't know. I use it when I'm talking to someone. I get triggered. Take a deep, good yogic breath, 4 seconds in, hold it for 7 seconds, and the whole universe, in that 7-second breath hold, the whole universe stops. it happens to stimulate the vagus nerve, so it gets a parasympathetic tone into better, into a better balance with the sympathetic tone, and just brings you down, and then slowly release over 8 seconds, and you can do it, and brings your breath rate down to about 2 to 3 breaths a minute, and it just calms me down and calms most people down. So I think it's a really important technique, and keep on doing it. Keep on doing it. You do it in front. You can do it with you're talking to somebody. You can do it in bed at night. It's very powerful, and I don't think people give it enough attention. So that I really talk to a lot of people about that. I think, any type of yoga, just presence, anything to do with presence. But yeah, avoiding any type of, I think people run to escape and just be with yourself, be with your emotions at the time. Like we get a lot of people, but I love books. I love the Untethered Soul. There's a big one by Michael Singer. I tell a lot of people to read.
It's a great
Letting
book.
Go by David Hawkins. That's, I think, I think that's the essence of psychedelics. It's not a book about psychedelics, but it's a psychedelic book. I think it's a wonderful book on the process of letting go, and it's very good for trauma and PTSD. Very, very, very good.
That makes
You
sense.
can
We
learn a
will
lot.
definitely
Yeah,
link to that in the show notes.
yeah,
How about
yeah,
ongoing therapy? I assume that
yeah.
is another useful part of making sure that these changes
Absolutely.
last.
Yeah. So anyone with PTSD, of course, most of our members who come into us are in therapy at the time and seeing a psychiatrist and a therapist. So we encourage people. I think it's also important that we recommend that they see their therapist a day or 2 days is a good time during in that sweet spot. So that 36 to 72 hours is a really good time to make their appointment with their therapist. So if they're doing 2 a week, I tell them to do it in the middle. But they should meet with their therapist, not the next day. I think the next day is a little too soon. The next morning, I think they'll be much more open the day after. So 2 days after is a great time. So yeah, therapy, and especially with someone they're comfortable with and they have a good relationship with, can be and the therapists have told me that they find people after they've gone through the ketamine therapy much more open. So people intellectualize, they've done through therapy for many years, but it's like actually bringing it inside of you to actually feel it. So, it's not just an intellectual process, it's an emotional, it's a feeling. That's very important with psychedelics, and that's the beauty of psychedelics, actually. So
I 100% agree with that. That's why I think these are
yeah,
so powerful, is that it's not somebody else telling you what they think would be helpful to you. You're telling yourself in the middle of this. Like you
hmm
said, when everything else is quieted down and you get to reveal what you really need to help heal yourself. I wonder about the PTSD with the self-directed therapy. Is that, you talked about your protocol and they come in 6 times. Do they do that each time, or is it just the first time, or is some specific time that they do that therapy?
yeah. So what we've been doing now is we've been waiting. We've been doing the three. We start off without the self-directed narrative therapy. So we see people with PTSD. They'll try 3. We see how they respond. After the third one, we have them fill out these questionnaires. And if we see there's a lag, there's a problem, that they're not really progressing, that's where we'll bring in the self-directed narrative for the remaining 3. And sometimes we always have the option of adding on if it's really entrenched to some really severe trauma. I mean, I've heard some stories that so really difficult. So some people do need more than just 6 sessions. They might need 8, they might need 10. Yeah, so we might extend it if necessary, or give them a little break and then go into boosters. Or we realize that some of the PTSD symptoms come back. We might do a 3 session booster with the self-directed narrative exposure therapy during the booster session, where we might do 1 a week rather than doing 2. We do 1 a week for 3 weeks. So that's another protocol we use with this, and we found it very helpful.
Interesting.
Yeah,
I was wondering, when you were talking about the music, which you so accurately described, like the music can
yeah.
change and then your entire experience can dissolve. How do it just occurred to me that, like, if you're dealing with PTSD and you're dealing with maybe a specific set of like things that we want to re-experience in a different way, is there a music choice that's related to that? Does everybody use the same music, or do you say, like, hey, bring in music that you like now, or do you bring in music that they listen to at the time of the trauma? Like, is there what does that look like?
We don't. So we have about 13 different playlists that are very well curated for this type of work. So we don't let people bring in their own playlists, with a couple of exceptions, with people who are very who bring in when we look over the music together, but it's very rare. But we have great lists of playlists. that being said, some people get triggered by music. We have people who come in, and if they hear someone talking during the journey, like we have some with Ram Dass talking at the beginning and at the end, and they will freak, really lose it. And there, some reason, I think it's having another voice, like people who had a very authoritarian parent or something, and having this voice come in, it could be very scary. Like this, another, it's authoritarian, so they feel like they're being controlled, mind control. So of course that could be triggering for some people. So we have playlists without any words, and hopefully we figure that out before they come in. But sometimes you don't know until they try it, and so yeah. So we'll cycle through a lot of these playlists, but we have like different theme playlists, Love and Light, all these other, ones that are more instrumental, ones that are, yeah. So everyone has different views. Music is very personal, but I also don't want people to get too comfortable with the music. I always tell people this is not, sitting there and it's nice to go and get a high from it. That's not the point. Some of the tones, some of the intonations, there's some intentionality in the music. So some of it's there to trigger some of the places that the darkness that we have, and to go in there and to learn some resiliency. So some people don't want to hear that, and we have to be sensitive to that too. But there is some intentionality in the music. Like, I don't know if anyone's ever done ayahuasca journeys or something. The music is jarring. I mean, horribly jarring. So, and so, but intentional, and there's a reason and there's a purpose for it. So, yeah.
Yeah, and you brought up something that I think is very interesting. I don't do this. I am not a facilitator, but in those like yourself who work with people who have a traumatic experience, like it must be an intricate dance to say, look, I'm not trying to re-traumatize you with this, let's say musical choice, but
Right.
to suggest to them that like we still have to put something stressful to get the results you want. Is
Right.
that, I'm assuming that's a real art to balancing that.
Hmm. Oh, it's a whole, and you have to really meet people where they are. So that's why it's a gradual process. It's a lot of the preparation. So they meet with an integration coach. Obviously, anyone who comes to a approach. So, after they meet with me, they'll meet with an integration coach who has all the information we picked up everyone goes through a medical and psychiatric evaluation, and we discuss traumas and different, not in great depth, but we discuss their family life and traumas that might have triggered their current events. So they'll have all that information in advance, and they read through it in advance. So when we talk to them, we talk about their intentions and what they're trying to work through. But we also don't want to overdo it. We want to let them to let go. So we're not there to have a whole, it's not about therapy. It's about creating a very safe space where they can go explore. So that's the purpose of integration, really. And what we do here is to create a safe, medically safe and an emotionally safe environment where they can really, but the medicine is them. They're the therapist in the end. I mean, that's why I almost have them choose the dose, because I want them to realize it's all coming from them. They have everything they need within them to heal. And so the integration, the coaches, we're facilitators. We're all, even the word physician doesn't mean, I'm not a healer. We're not healers. We are teachers. The word, the Latin, it comes from the word teacher. So we're here to give them a tool to teach them an option, and then they can do it. And when they learn they have the power within them, that's what I bring to psych. I really believe psychedelics are all about. It's a personal experience, very deep and inward, and the journey is not outside of you, it's within. There's a whole universe within us. So people get scared about, oh, where am I journeying to? You're not journeying outside, you're going inside, and it's vast. I mean, it's really
Yeah.
vast inside. So, and sometimes that can scare people, but hopefully with this work we help hold people and hold space in a way that people feel safe doing so.
Yeah, absolutely. By the way, listeners can't see this, but I was like fist bumping, like waving in the air when he was describing how we are physicians, we are not healers. Like you said, you are
Right.
teachers. I love that. That's one of the, it's a little thing, but when I see physicians or other people calling themselves the healers, that takes the autonomy away from the patient and says like, you have to come to me to be healed. Takes away their internal, ability to heal themselves and puts them. And I think that sets up a power dynamic that is fraught with, risk at that point. And so I really appreciate you highlighting the fact that you are just there to give them the tools, to teach them, how to use the tools, but they have to do the work themselves,
Yeah.
and they can do the work themselves. They don't need somebody else to heal them. So I really appreciate you putting a point on that.
Yeah.
We could talk about this all day. I love hearing these
Mm.
great stories and how, every time that there's something else shown to be effective for yet another condition, as you guys are, I look forward to when your research is done and then comes out, because I think, the more tools we have for each of these and the more we know, exactly how, like you said, with your adjuncts, with the self-directed therapy, on how to make these the most efficacious, we're just going to continue to give more hope to people that were, like you said, in some pretty hopeless situations. Can you tell us a little bit about Nushama and where they can find you in your work?
So yeah, Nushama is located in Midtown Manhattan. Very cool, but a beautiful environment. I've taken a tour of it. It's a very nice. It's definitely a serene space. So we're on 50th. We're at 515 Madison Avenue, and on the corner of 53rd and Madison. Pretty close to train stations, and we have the E train in our building, E&M train. So you can find us there. You can find us online at nushama.com, Nushama, nushama.com. It's an interesting name. Comes from actually the word it's a Kabbalistic Hebrew word for soul, but a different level, a balanced level of soul. So, and yeah,
I like it.
it's,
Well, very nice.
yeah,
Your team
thank
has
you.
always been quite friendly and open and honest, and you guys were early members of the association, so I've always appreciated
Yes, thank you
your
for putting
dedication
it
to the
together.
field. Oh, I appreciate that. So yeah, I see how much you all are dedicated to this work, and I appreciate what you're doing, and I look forward to seeing the research. And I'm just very grateful for you coming on and sharing with us today.
Thank you for having me. I really appreciate it.
Absolutely. All right, for everyone else, until next time. Thanks so much for listening to the Psychedelic Medicine Podcast. If you enjoyed what you heard, please leave a rating or review, as it helps others find the show. And if you'd like to learn more, you can find the show notes at plantmedicine.org/podcast, and there's information for clinicians at psychedelicmedicineassociation.org. Our incredible music was by the one and only Porangi. We'll see you next time.